Welcome to the quick review on dosage forms. In this lesson, we will briefly review what are dosage forms, why do we need dosage forms, and how can we classify dosage forms. So let's begin by discussing what are dosage forms. According to Cizan's Medical Dictionary, dosage form is a term for physical characteristics of a drug product, for example, tablets, capsules, or solution, which contains the drug substance and almost invariably other ingredients such as excipients, fillers, flavors, preservatives, emulsifiers, etc. Simply speaking, dosage forms of a drug are the forms in which a drug is available as a formulation in the market and can be easily administered to a patient. For example, acetaminophen, commonly sold under the brand name of Tylenol, is available in at least three oral dosage forms, including tablets, capsules, and syrups. By the way, in case you forgot, we define any chemical substance as a drug if it is used in the diagnosis, prevention, or treatment of a disease or health condition. Now, coming back to the topic of dosage forms, formulation of a dosage form often involves combining active drugs in specific quantity or strength with inactive ingredients. Now, these inactive ingredients are also called as excipients. Selection of inactive ingredients is based on many factors such as type of dosage form, for example, whether the final dosage form will be tablets, syrup, or gels. It also depends on our expectations from the dosage form. For example, how long of shelf life is expected from the dosage form, whether the dosage form is meant to be used internally or externally. We will discuss more details on excipients in a separate video. By this time, some of you may be wondering, why do we even need dosage form for drugs? A short and simple answer would be, many commonly used drugs have high potency, meaning we need only few milli or micrograms to produce desired clinical response. Also, drugs can even have undesirable physical and chemical properties that can lead to lower stability, poor absorption rates, and other issues like that. A dosage form can help us in dealing with some of these challenges. For example, levothyroxine tablets, also known as brand name Synthroid tablets, allow us to administer quantities as low as 12.5 micrograms for treatment of patients with hypothyroidism. The next obvious question on your mind may be the types of dosage forms. Actually, there are many ways in which we can classify dosage forms. In fact, this may vary by the depth of knowledge required in your field and preference of the instructor or the author. We will go over all major ways of classification and then go over each type. So let's begin. As you will notice in the figure on your screen, there are four main ways of classifying finished dosage forms. First, and maybe the easiest way, is classification based on the rate at which the active drug is released from the dosage form. According to this classification, dosage forms can be of two broad types: immediate release dosage forms and modified release dosage forms. As the names indicate, immediate release dosage forms start releasing the medication as soon as they are ingested, whereas the modified release dosage forms modify or change the rate of drug release from the dosage form. By the way, modified release dosage forms are also known as timed release dosage forms. Next way of classifying dosage forms is based on physical state of the finished dosage form. Accordingly, dosage forms can be solids, such as tablets, capsules, and powders; semi-solids, such as creams, ointments, and gels; liquids, including monophasic liquids, such as syrups, as well as biphasic liquids, such as suspensions. Gaseous forms of the dosage form include nebulized solutions and aerosols. Probably the most commonly accepted way of classification is based on the route that is used by a patient or healthcare worker to administer the dosage form. According to this way of classification, dosage forms can be oral, meaning those ingested via mouth; topical or transdermal, meaning those administered via skin surface; parenteral, meaning those administered by a route other than the GI tract, for example, injections; Other ways include rectal, vaginal, pulmonary, nasal, ophthalmic or ocular. We will discuss more details on these routes of administration as well as pros and cons of each route in another video. Once that video is available, you will see the link for that video right here. Sometimes finished dosage forms are also classified based on the way these are packaged for the patient. For example, unit dose packaging such as blister packs or bulk dose packaging such as powders. We hope you found this video helpful. Please don't forget to subscribe for upcoming videos. For requesting videos on a topic of your choice, as well as free downloadable resources such as slides, please visit us at wethegurus.com. Thank you for your time.